Thank you. Okay, so we are going to start out by playing a game. Not nearly as sophisticated as Noah's games. So I guess I need to figure this out over here. All right. I'm going to tell you 2 lies and a truth. That's like this before, right? All right. So one is a tiny muscle in the middle ear contracts and stiffens the middle ear bones to protect us from our own voice. Think about that. 2, earwax is beneficial because it's noxious to insects and keeps bugs out of our ears. Think about that. And the last one is the outer, middle, and inner ear interpret the meaning of sound. So I'm going to have you guys raise your hands. Who thinks that the first one is a lie? The tiny muscle in the middle ear contracts and stiffens. That one? Okay. Seems to make sense. It's actually, yeah. These aren't trick questions, I promise. I'm going somewhere with this. Okay, earwax is beneficial and is noxious to bugs. Does anyone who thinks that's a lie? All right, last one. The outer, middle, and inner ear interpret the meaning of sound. Who thinks that's a lie? You guys are so smart. You don't even need me up here, right? That's the lie. The outer, middle, and inner ear is a way for sound to get in, all right? It's not where sound is interpreted. So anything coming through that area is going to travel up through the midbrain, going to land into the primary auditory cortex, and then to the frontal cortex and associated areas. We actually make sense and interpret sound in our brain. This is just the way. So if you're a nerdy scientist like I am, you love to measure. And for people who are looking for metrics on how to measure things, the auditory system can provide many. You can see that here we have an adult. We like electrodes. We are usually trying to record a very passive and tiny potential. So typically you need to be still. Because if you're moving your arms or flailing around, those are much, much bigger potentials. Babies, we can test babies at birth. In fact, in the majority of states, we do that already. We can test dogs, and we can test horses. We test actually quite a few things. And you can also see here this pathway, these little squiggly lines, that's how we measure, all right? And you can see that along the bottom axis here, you have milliseconds. And we're going to talk about what those mean here in just a second. And then on the top here is amplitude. And these little waveforms have a lot of meaning, all right? You can kind of see the different stopping points that you see these big waves happen. About 20 years ago, we actually passed laws that infants born in hospitals before they're discharged will have a hearing test. And one of the reasons for that is because we know that hearing is one of the leading birth defects. And if we catch it early, we can make a bigger difference. So these laws were passed. And so if you have a child or a grandchild who's at the age of 21 or 22, they most likely had a test in the hospital. We suspect, and what the research shows is about 2 to 3 per 1,000 live births, we're going to find a hearing loss, all right? Problem is, we're going to miss a mild hearing loss. And Mild does not mean inconsequential. The screeners in the hospital screen at 35 dB. That's a hearing loss for a baby. And you ask me, well, why wouldn't we test that? Because these numbers would actually be higher. And we don't test that because in order to get the hospitals to actually do this and not have so many referrals, that was the compromise. So we don't catch all the babies at birth. And we also lose a very large percentage of them, what we call loss to follow-up. We can diagnose and find them, but we can't always follow up with them. Language is sovereign. Language is what and the reason why we are trying to find these infants, because we know if we get amplification on them within the first 3 months of life, if we get them enrolled in the early intervention within the first 6 months, and if they're on track for a CI, for cochlear implant, if we can get them on that track and get them implanted by the time they're 12 months old, and all these kids having early intervention and proper intervention, by the time they reach kindergarten, they can mainstream into language. I'm not talking about methodologies here. I'm not talking about sign or spoken language. That becomes, I used to always tell my families, I support family choices. And this little jewel right here is my daughter on the day of her activation. She's profoundly deaf, the joy of my life. She was 6 years old when we finally got sound to her. And you won't find this little one in any of the books. She has surpassed what finding a child that had no language at 6 years old should. Her mom had a little to do with that. So we know that at birth it's one of the leading birth defects, all right? But just because you pass a newborn hearing screening doesn't mean that you won't end up in hearing loss later on. And I'm not talking about when you're 65 or 70. I'm talking about in those first 3 years of life. It's called acquired hearing loss. And there are many, many reasons why children will have an acquired hearing loss. One of those is just pure genetics. We are who we are, right? Sometimes anatomical reasons, infections and viruses that a mother carries in the womb that may not even know, like CMV, toxoplasmosis. Antibiotics at birth. We have means to keep infants alive earlier. We have to do it sometimes at the sacrifice of hearing because the antibiotics, gentamicin, tobramine, a lot of the myosin drugs also are toxic to the little hair cells. So if you have the genetic makeup that comes from your mother, it's mitochondrial, if you have that genetic makeup and you are given those drugs, the chances of you getting a progressive or acquired hearing loss is great. So we monitor those children for a long time. So there's a number of different reasons. We haven't even touched on the fact that one of the biggest reasons for pediatricians to go visit is because of hearing loss. Fluid in the middle ear. The Center for Disease Control, I would just say CDC, right? They estimate that by the time children start school, 15% will have some form of hearing loss. So we have, at birth, we know it's leading birth defect. The CDC tells us by the time they start school, 15% of the population has some form of hearing loss. How do we find them? Well, how many of you remember in school having hearing loss? Remember? Yeah? Some of you are not shaking your head, yeah? Some did, some didn't, right? The Individuals with Disability Education Act, the No Child Left Behind, includes within that framework something called child find. It is not a suggestion, it's a law. Every single school district in our country is to locate, identify, and evaluate children who may have disabilities and special needs. They all have, from the state down, different ways that they do that, but it is their job. And what I mean by that is, if you're in a school district, that doesn't mean just public school. The school district is responsible for all the children in that area. You guys probably didn't know that. And here are the different categories. These are the categories if you are found to need special education services, you will be classified into one of these different categories. And this is for across the country: autism, deafblindness, deafness, emotional disturbances, hearing impairment, intellectual disability, multiple disabilities, orthopedic impairment, other health impairment, specific learning disability, traumatic brain injury, and visual impairment. Depending on the category that your child falls into, it's dependent on how much the state will give money to the school to help with that child. Hearing loss and blindness are the two most expensive. So if you have a child and they go to a public school and they are identified as having, and the category reads hearing impairment, that is one of the highest paying, because we have to have a very specific set of professionals to work with them. There's also technology involved, all of that, right? So if you look over here now, this was in 2021-22, right? This is a pie of the nation's categories, all right? And you see this huge category, specific learning disability. But what I'm going to tell you is, it's not very specific. This is the category of anything that we don't really know what's going on. Really smart kids who can't read, dyslexia, ADHD, ODD, whatever you want to call it, they all get kind of put here. We don't really have a great idea, which is interesting that they call it specific learning. As you go around this pie, you notice that what's missing. Hearing impairment. Didn't we just say it was one of the leading birth defects? Didn't the CDC say that we have so much acquired that by the time they start, it's 15%? It is so minuscule on this pie, it's not even represented. It's under 2%. Where are these kids? What happened to them? These aren't numbers I made up. These are numbers that are out there, and nobody is looking at them. We had a huge problem. We've lost kids that have hearing loss. Where did the children go? So, I sold my practice. I had my own practice for years. I sold it 5 months before COVID. I wished I could tell you that I had a crystal ball and I knew that was going to happen, but I didn't. I just was the luckiest person on earth, I guess. But what I did was I started a nonprofit. And my mission is to find these kids. My mission is to find them. I was just in Oklahoma. I'm from Oklahoma. And so I had an interim study at our Capitol with the General Education, Common Education Committee. And if any of you know anything about changing policy, it's a bit like poking your eyes out with hot sticks. It's just difficult. But what I did was I went, okay, I want to look at numbers before COVID because I'm sick and I'm tired of everyone saying, oh, well, that's COVID. My daughter on virtual school made 4 years progress. Well, I don't know what we say these kids lost progress, and I believe it because we're looking at the numbers. What the heck was going on? So here's our numbers, okay? We averaged about 1.7% per 1,000. This was the 5 years, so a kid would be 5, leading up to 2019, all right? If we looked at the CDC's 15%, that would be 104,000 kids. We had a school enrollment of almost 700,000. And if you even went, I pulled a ton of research down, and what I found was that the smallest percent was 3%. The highest percent was 23% of kids with hearing loss. There's not a ton of studies out there. I went with the most conservative. I went with 3%. How many kids do you think we had categorized in the category of hearing impairment? Guess. We're looking for anywhere like, this is conservative. This is what we're looking for. This is going to be 15%. That would be high. That'd be on the higher end. 10. You're kind of close. I'm just not lying. Not really 10, but that's how many we found. Where are our children that have hearing loss? Our reading scores are plummeting across the country. We are conservatively missing 19,552 children. And that's a conservative number. And if you think Oklahoma's bad, let me show you the rest of the country. In a minute. 3 Oklahoma truths. And these were on our most recent report card. 52% of our first and second graders are at a reading risk. 71.5% of our fourth graders are not proficient in reading. That is an astronomical number, guys. And almost 75% of our children in fourth grade are not proficient in math. If you stop and think what this is going to mean to our country economically, it's disastrous. This is an epidemic. This is a ginormous proportion of children struggling to read and do basic. And look at the country. Where's your state? Look at your state. You're not doing any better. No one is looking for these children. We are giving them labels and diagnoses they don't have. And I'm going to show you that in just a minute. We're, 19,000. What I did was I took the enrollment, public school enrollment, and I took 3%. And then I looked at how many they had identified. This is how many children. We're looking at 1.2 million children conservatively have hearing loss and are going either misdiagnosed. I don't know. Where are they? You tell me. I have so many audiologists out in the schools, educational audiologists that want to argue with me. And I'm like, I did not make these numbers up, guys. I went to your educational website. I pulled down the numbers and then I verified it with the national numbers. This is, where are they? And I pulled this particular slide because here are look at the least literate. 13% had hearing difficulties. How close is that to our 15%? This number before, the 1.2 million, I'm telling you that's conservative. "14 states don't even require you to test a child's hearing when they start school. And these 14 states, typically you'll find at the bottom of most lists. Oklahoma and Louisiana typically are trying to fight it out at the bottom, but there is no mandate. A child can start school. They typically have to have a vision test because the people who are literacy experts think that dyslexia is just a vision issue. You don't have to have it. And I would argue that any reading issue is an auditory skill. That's why we teach it in phonics. All other states are still testing like we did 50 years ago. Listen to the technology that's going on in this room. Look at all the amazing, unbelievable ways that we can spend our money. I mean, I just realized that being at this conference, I'm going to go home broke because I'm going to have the sleep machine. I'm going to never have the neutral. I mean, it's crazy, but we are still putting a child and we're going, raise your hand. And you might get the president of the PTA to do that. We don't even have professionals with any sort of auditory knowledge that are doing that. In the state of Oklahoma, it is required you have what we call an individual educational plan. They call them IEPs if you're on special education. You are required to have a hearing test. And you know what? I go into schools. Those audiometers haven't been calibrated in 8 years. It has to be done yearly. I am not making this up. I can't make it up. It's crazy to me. So when you're doing this test, do you remember when you saw the picture of the auditory pathway? Let's look at that. I think that might be next. When you're looking at the auditory pathway and you go, okay, raise the hand to the beat. What's the beat? It's a pure tone, right? How many times do you encounter pure tones in your life? When you do a hearing test, maybe. Our life is about speech, right? Our life is speech. It's not pure tones. So I can put a 500 hertz pure tone in and the child can hear it and raise their hand. It's just them recognizing a sound. But what if I say the word but? And they say it. Is it because there's a speech delay? Or is it because they have audio jitter along their auditory pathway? No one's testing it. No one is testing how the brain is hearing. No one. Not in our schools. And we have a reading epidemic. The reading scores, and if you look prior to COVID, we already had a reading epidemic. It's just gotten worse. No one's looking for our babies. Here's your reading pyramid. And I'm not going to argue with the reading pyramid. It works. The reading pyramid works. All right. What's here at the bottom? Phonemic awareness. Do you know what most kids struggle with in school? Phonemic awareness. You know why? Is it because they're dyslexic? I don't know, maybe some are. Is it because they're ADHD and they can't sit there? I don't know, probably some are. There's a large majority that have an auditory pathway problem that's preventing them from being able to do the very foundational level of reading that they need to do. No one's checking how their brain is hearing. They're just saying, raise your hand. All those states that you saw, the ones that have mandates in place, they're no better than Oklahoma that doesn't even have a mandate because they're not looking for the right thing. Yes.
What is phonemic awareness?
Phonemic awareness is how you put together a sound. Cat, you're putting the phonemes together, and hopefully you can blend it. But even at that most foundational level, we're not sure. Does the child hear? Does the child hear? You don't know. But this is the level where the majority of them have problems. So if you can't get past here, how is all this going to happen? It's not. Can't. And this isn't my pyramid. I didn't do this. I believe it. I mean, I've seen kids. I went through this process. Oop, I'm going to tear that thing down. So my point here is, we hear up in the brain. It's a long way from the point that it comes in to get here and make sense and interpret. There are so many things that can happen. And let's talk about, what does that look like? What does an auditory processing problem pathway look like? These kids have normal to high intelligence. There's no mental or cognitive issues. They have extreme difficulty hearing speech if there's any background noise. Johnny, sit down. I told you to sit down. Johnny doesn't hear. Johnny hears blah, 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 blah. So Johnny automatically becomes a behavior problem. Johnny, I'm going to send you to, he's like, what? He doesn't hear in background noise. And if you've ever been around these kids, I can spot them like that. I don't even have to tap them. Like, oh, there's one. Problems with multi-step directions without visual cues. I would always have parents say, oh, he understands. He can follow directions. I go, really? Show me. Johnny, go put that in the trash. I'm like, no. Don't use your hand. Now it's something different. Johnny can't do it. Because we're here to do this. They're following visual cues. Easily distracted by sounds. Often ask people to repeat. Huh? What? Trouble remembering details that they read that are spoken. They take longer to respond. Difficulty with localization of sounds. Where's it coming from? And they're usually very disorganized. What does that sound like? Anything else you know? What other kind of problem? Yes. Many of the same issues. So are they ADHD? Or do they have a problem along their pathway? How do you know? Remember, largest category. And what we're doing, the second largest, is speech and language. Children with auditory pathway problems, at the heart of the problem is speech and language. So we're treating a lot of the symptoms. We're not treating the problem. I want to tell you about Nick. I want to tell you about a patient of mine. Nick was extremely smart. He was able to put Legos together 12, 13 years older than what he was, because how did the Legos, what is the instructions? They're visual. He could do anything. He became the ambassador of kindergarten because he had to do it a second time. Most of these kids repeated grade. He couldn't read at the beginning of second grade. Talking about an incredibly smart kid. Horrible handwriting, sensory issues, tags on shirts, man, just dropped to the floor. Very disorganized, could not follow verbal multi-step directions. Couldn't do it. And hates. Here he is right now. He would build his own computers. Not a dummy. He was diagnosed with anxiety and ADHD. he was medicated with Abilify. Smoking bomb there, right? But he also, at the same time, was identified as having extreme allergies to horses. Now, this kid lived midtown Tulsa. There's no horses. But because of living in Oklahoma and the wind comes sweeping down the plain, you have horse dander everywhere, right? So his mother said, speaking of Jerry Seinfeld, we're not going to be the boy in the bubble. We are going to get over this. And he was a needle boat. There was no needles that was going to happen. So she enrolled him in horseback riding lessons. And guess what happened? Think about, have you all seen how horseback riding lessons? I'm going to show you an example. You're sitting up on the horse, right? And you've got this big beast and you've got your hands out and you learn to what's called post. You're posting with the horse. These big proprioceptive muscles getting, not only did wonders for his sensory issues, he started breathing. His auditory system was so desynchronized. He had the worst case of an auditory pathway disorder I've ever seen. Nick is my son. I'm an audiologist. I missed it. And I was so willing to take a diagnosis of ADHD because medicine will fix that, right? No, he hated it. He wouldn't take it. What I'm showing you here is, how do we know? We have to measure. We have to look. We can't assume, oh, they have ADHD. Oh, they're dyslexic. We are not doing our due diligence. We are not doing the testing that we need to be doing because my son did not have ADHD. He had a very significant problem here. Now, let me show you what you're looking at. This is what we call a P300. And it's a P because it's a peak. And it's at 300 milliseconds. All right? At 300 milliseconds, we're up in this area right here. And let me tell you what the paradigm, it's an all-about paradigm. And I say to the patient, okay, you're going to hear some beats. And you're going to, every so often, you'll hear an odd beat. I want you to count odd beats. Because what happens when you count? Nerves. Whoosh, and you get these big peaks, right? We can measure these. If they're delayed, we know there's a problem. There's a bump. There's a bump along the highway somewhere. Here's cleft here. Beautiful. And what we do is we start it with a rarefaction, which goes up like this. And then we go back and we do what's called condensation. It starts at the bottom and goes up. And if it's a true neural response, they meet up and they go together, which is what you see right here. Boom, boom. You see this? See that wonky thing? That's what we call out of phase. Rarefaction went up, condensation came down, and they canceled each other out. There's no response here. That is a no response. What does that mean? Hell of it. But I knew how to fix it. Dumb luck. Just like when I sold my clinic. I had to synchronize the auditory pathway. The only part of the auditory pathway that is plastic is this auditory nerve. If you have a problem at the level of the outer, middle, and inner ear, we're going to fix that with a hearing aid, a cochlear implant, a bone anchored hearing aid. We're going to fix that with a device so that sound can get in, right? Because what we're trying to do is get it up to the brain. If you have a cognitive problem, that's a different issue too. But along this pathway, it's plastic. And guess how you fix it? There's different ways. I don't want it to sound that simple. Typically, it's a timing. Typically, it's a jitter. Typically, and I can measure it. I can measure all of them. So by him learning to ride the horse, what was he doing? He was teaching his brain, this is how we learn. You can do the same thing with music. Kids who learn musical instruments can hear better in background noise throughout their whole lives. There's good reason to have music. Learning rhythm. There's a program called Interactive Metronome. Learning to keep a beat. In fact, my test protocol for littles has a rhythm test in it, because if they can't keep rhythm when they're little, something ain't right. Like it. And you know what? School was a struggle forever. I had to send him to military school. I was like, you're not going to fail on mine. Ugh. But you know what? He would have been one of those kids that dropped out. He just had a mean mom. We're misdiagnosing. We're missing children with auditory pathway disorders all over the country, really all over the world. What do? That's really a whole different topic. And I think I'm probably getting close here. But I will tell you in a nutshell what we do. First, we start using contemporary methods to test our things. We don't use technology that's 50 plus years old. Second of all, not only do we pass legislation, every single state in this country should at least require their kids to be their hearing tested. We standardize. So these kids got it, these kids didn't. These, we test here. No, we standardize. We test speech. We test speech and voice. Your games, Noah, your games are awesome. And you know why? Because kids will do it. There is an app called Sound Scouts that was developed in Australia by just some really brilliant people. And it tests speech and quiet, speech and noise. Remember, these kids struggle in noise. It's going to show up. And it does tones and noise. We're going to catch anything along the auditory pathway, whether it's a problem that we need to fix with a hearing aid or cochlear implant or an FM system, or if it's a kid that has an auditory problem that may need musical intervention, rhythm, or, some of the other things that we have up our sleeve that we can do. And we use technology that we have today to reach kids. When I give this talk to my fellow audiologists, you know what they say? First, they don't believe in numbers, but after that, they say, there's not enough of us. There's a shortage of audiologists, and there's a huge shortage of pediatric audiologists. So what do? We use what we have. We use telehealth. I am in the process right now of building a pediatric protocol on a platform called Tuned, which will be able to reach those children who may never, ever in their lifetime see a pediatric. Does it replace face-to-face? Nothing does that. My goodness, guys. One is better than zero any day. Any day. That just tells you a little bit about the P300. So I'm a little passionate about it. Everyone said, how did you learn to be an audiologist? I said, I don't know, but my life is set. I had a deaf daughter and a child processing disorder.
So as we're talking, guys, thinking about that, seeing connection you made between gaming and that's not. So part of the way you solve this problem is to that and think. So I'm curious. The other day, something came up on my apps that was a high frequency noise, and it was like, where can you stop hearing this tone and tell you what you're hearing? Wondering, I know you don't know what episode you think.
They're actually quite accurate. In fact, it tells me to shut up. Hang on. They're actually quite accurate. Some of the gaming ones that we use for the auditory processing and some of the testing is done on the iPad, and it stays. No one help me if I'm not saying this right, but from what I understand, the calibration stays pretty consistent if you use the same transducer. We use Sennheiser HBE2023. And they're calibrated. With the rhythm test, it's the same thing. We use an iPad because of the touch. There's like a delay.
Sounds reasonable.
It sounds reasonable. We'll go with it. But yeah, no, they're pretty. And then you touched on another thing. Typically, we only test up to 4,000 hertz, and we'll test it. A lot of schools will test at 25 dB as a screener, which is a hearing loss in a child. So you're missing them again. And because of all of the headphones and insert earbuds and all that, we need to be testing at higher frequencies now because that's where that. Yeah, and we're missing those kids. Yeah.
So with the horse therapy and such, is part of that due to interaction with the vestibular system? Are there different therapies that can, since they're still connected?
Yes, you can't really, they're housed together, the vestibular system and the cochlea, they're in the same little bony labyrinth there. They share the same digs, right? So you really can't do one without the other. I believe that was the answer to the sensory issues that he was having. I mean, a kid would drop if there was a tag on the back, and as a parent, any of you are trying to get your kids ready in the morning, it's like, oh my God, again. I'm sure that had a lot to do with it. As far as the reading goes, I think that had more to do with synchronizing the auditory pathway. That auditory pathway really doesn't mature until we get maybe 12, 13, even later. The things that, and everyone's like, well, why do you have this huge epidemic of reading now? Well, first of all, things that will affect the auditory pathway is low birth rate, prematurity, middle ear infections, genetics. And look, we're keeping babies alive younger and younger and younger. So the amount of children that we're seeing that have these delays is greater because we weren't able, back when I went to school, those kids didn't survive. 23, 24 weeks. I mean, that wasn't, few did. Okay.
Yeah, I guess still a little deep. So I can imagine somehow that sensory information from vestibular would help with generating that rhythm and
Yes.
Okay.
Yeah.
All right, so I'll have to look more into that sometime. That's interesting.
I would love to give you some art tricks.
Great.
Yeah. Oh, good.
We'll talk.
Yes.
You mentioned in the beginning of your talk that if you were inserting or some of your colleagues were inserting electrodes into porcelains,
They're just tapes. They're not inserted.
So it's not like a single neuron. I'm sorry. So
Yeah, no, so they're regular electrodes and we have like a ground. And then we have one on each side, whether, left and right. Usually there's another one up high. And they're far field recording. And so they're potentials. And what we're looking at when you saw that in the brain, those are like little way stations along the way. And they get a big boost. And I always tell people, do you guys know when you go to a game and you do the wave? You do that. How do you know when to do your part? Well, it's tiny, right? It's the person next to you. And so if everyone does it right, and that's what we're doing is those big wave stations, that's what we're recording, it looks like a wave. But if everyone's just jumping up randomly, then that's when we get that response that you saw as a no response. That's just nothing.
So interesting. For kids that struggle with hearing impairment,
We've got a last few years of Zoom school or like screen-based and there's
Anything that's visual for those kids is phenomenal. And I'll speak as a parent on that as well, my daughter. We used, I called it stand on your head reading, whatever it took. And we used what was called cued speech, which is actually cueing it's a method of showing a child what you're saying. Like if I said act, if I signed it, act. But if I'm doing cued speech, I'm showing where the sound's coming from using my mouth and like if there's a voice near them. She took off. A lot of these kids that are having reading trouble, that are struggling, I truly believe that cued speech or visual phonics would help them tremendously. To see it. She never heard the S on the end of a word. S's are important because they're plural and, one or two. So if you signed it to her, she heard it. I mean, she knew every time. But she didn't always hear it. So yeah, visual for people with hearing loss and deafness is huge. She's also really smart. Oh, thank you.